live on Facebook and YouTube at 10 a.m. on Mondays, coming from the Remax First Studios here in Jeffersonville. We appreciate y'all tuning in today. Hey, like and share this so other people can find out about community leaders and other businesses in our community. That's our objective, to keep you informed and let you hear from our community. And if you know somebody that would be good on the program, drop an email or put a comment below on social media, and we'll do our best to try to contact them and get them in as part of the program. At the end of the show, I'm going to share a little excerpt from this book, Og Mandino, The Greatest Salesman in the World. This is a great book, some life principles and work values to live and work by. If you haven't heard of this book, you can go to Amazon. It's a great little read. The 10 scrolls in there are towards the end. But it's about $7 on Amazon. So if you'd like a copy of it, go ahead and share and comment. I'd like a copy of Og Mandino's book, and I'll get you one in the mail. So make sure you like and share and make a comment, and we'll get you a book in the mail. All righty. Let's see. Our special guest today is Health Officer Dr. Eric Yazel. We have the great fortune of having him on the program today. Dr. Yazel graduated from Indiana University with a BS in biology, followed by an MA in clinical psychology from Ball State University. He received his medical degree from the University of Louisville and completed his residency in emergency medicine there as well, serving as chief resident. He serves as an assistant professor of emergency medicine at the University of Louisville, as well as an attending physician at Clark Memorial Emergency Department. He also serves as the Clark County Health Officer, Chief Medical Officer for Life Springs Health Systems, Chief Medical Officer for Blue Mine Health, and Chief Tactical Physician for the Jeffersonville Police Department, and Medical Director of the Meade County EMS. I don't know about you, but I'm exhausted from reading all that. I don't see how he has time for life. Eric was born in northern Indiana and grew up in Indianapolis. He has been a Clark County resident since 2006. He enjoys traveling, basketball, and all things outdoor, especially spending time with on his farm in Borden with his wife and 2 children. So, Eric, how are you today?
Yeah, I'm doing great. Thanks for having me this morning.
I'm not so sure if you heard the intro or not, but I read your intro bio there. With all the places that you serve, I'm not for sure how you have time to enjoy that farm. It seems like to me you're probably on the go 24/7.
Well, there's a lot of hats there. Fortunately, a lot of times when I'm doing something, I'm wearing 2 or 3 of those hats at the same time. So it's manageable, but it's busy. But yeah, I get to do a lot of cool things and meet a lot of awesome people. So I can't complain.
I'm sure I can tell by, some of the places you serve, kind of like me. I love serving and giving back to the community. So I can tell from your bio that it's, you love blessing people and serving back to them as well.
Yeah, there's no greater reward. And that's one of the reasons you go into healthcare, is to help others. And through a lot of these different positions, I can help and impact people in a lot of different ways, which is really cool.
Yeah. You talk about there going into healthcare. At when in your life was the interest sparked that you thought, I think I want to be a physician? At what point?
Yeah, actually, my parents kind of fostered that, and we had a family friend who was an ER doctor, and he would actually let me come in and shadow him at a really young age. And I was like, this is just the coolest thing I've ever seen. So I, kind of grew up with that in mind. And then as I kind of explored different career paths, really, there wasn't any other option that I was interested in. It was just always something that was a passion for me and that I wanted to do. So.
Yeah. So I believe in your bio, it said you came to Clark County in 2006. So a little bit where you're from, or are you from northern Indiana, I believe?
Yeah, I was born up in Michigan City, Indiana, and then moved down to Indianapolis. My parents were both educators. My dad was a coach and then a school administrator later. So kind of got the whole state covered, because I started up in Michigan City, which is way up almost to Michigan, then Indianapolis. And then I actually came down to Louisville in 1999 and then moved over across the river in 2006. So, I've been here long enough now that I'm basically a local. So.
Yeah. And your residency and University of Louisville, I'm assuming, brought you down this way?
Med school and residency. Yeah.
Yeah.
Cool. I came from med school and stayed around for residency and stayed around after that.
Yeah. So, one of the many hats you wear, and the one that I'm most familiar with, as the Chief Medical Officer for the Clark County Health Department. So, I know you just moved into a beautiful new building right there, which was well deserved for the health department. Lots of space there, several employees in there. What does the health department really do for Clark County?
I think when people hear what we do, they'll be, really surprised because it's just such a broad range of things. We do what we call environmental health, where we do restaurant inspections, septics, pool inspections, all sorts of things along those, and any kind of environmental disasters we're involved in. And then we actually do a lot of other medical side of things. Obviously we're doing all the case investigations and management for COVID-19. We also do HIV care, basic medical care. Just a huge range of services. To be honest, we do birth and death records. The list really goes on and on. Anything that you can think of that isn't directly hospital related, that has anything to do with the overall health and wellness of the county, we're involved in, and try to keep that philosophy that we want to keep reaching out and bridge any kind of gaps there are in the community.
Right. You mentioned COVID-19, which has been a huge monumental task for the health department managing the pandemic here in our area. Any updates or words of caution or anything our listeners might need to hear from the health department?
I'll have to say the Indiana plan has been excellent so far. It really has. I think, it was always a very difficult balance. Everybody wants medicine to be black and white, and COVID-19 has been nothing but gray areas. And I think in the medical field, we've tried to work around that to some degree. And some you'll see medical experts saying this is fact and this is fact. Everybody's afraid to say we just don't know, and to be honest, we don't on a lot of these things. This is something that's brand new. So our philosophy here locally is just to try to make good common sense decisions, and be transparent and keep everybody informed. And as the cases started to decline, when we started to gradually open up, and I think Indiana has navigated that in a safe manner, and we've gone along with the state plan because honestly it's been excellent so far. And right now, I think things do look good. We're still seeing some cases, so we can't totally relax, and we need to continue to follow the state guidelines very closely. But the cases we do see seem to be clustered in very specific areas, which is much easier to manage than the more widespread cases we were getting when this first started. So the hospital's doing great handling this as well. Last I heard, they're down to about 8 inpatients that had COVID. So we're really seeing some good numbers and not seeing that second wave that we always heard about as we opened back up, at least yet. So we'll see how that progresses.
It's been much talk about potentially a second wave in the fall when the weather cools down. Do you anticipate maybe?
That is the $1 million question. It really is. And, there's just so many unknowns with it. I think we'll see some cases next fall or winter? Yes. Do I think it's going to be, to the point of like the flu where every winter we have, COVID season? I don't think so. I hope not. I certainly don't want to have, April be our quarantine month from now on or anything like that. So I think we'll probably see some cases, but I don't think we'll see the widespread outbreaks that we have to date. But that's just my opinion. I've heard both sides of the public health spectrum, say one says yes, one says no. We don't know yet.
Right. Well, hopefully sooner than later. I know things take time. We'll have some kind of a vaccine or some kind of a medical treatment that'll, help suppress the effects of COVID-19 on the human body. So, and I'm very hopeful that that'll happen sooner than later.
Certainly would help us a lot. It still is gonna take time. So I think we're looking at next winter. It's probably the earliest, but that would help us immensely, obviously, in the management.
Right. So when I was looking on the health department's website, it seemed like there were a lot of programs and things on there that may be available for the public. Are there specific programs that people may not be aware of for immunizations and different things that the health department offers?
Yeah, you mentioned immunizations. That is one thing we do, and we do encourage our children. As we're getting ready to go back to school, whatever happens with school openings, we do recommend that everybody get immunized and immunize early. So we certainly want to do that. So that's a big program of ours. So that's one. We do, and you mentioned our new building. We really are excited to be in our new building, and we want to kind of expand our programs that we offer now that we're in there. And we do plan to do a lot of public education forums because we have now a nice big conference room where we can invite the public in to do some education. We are doing a lot of CPR training. We have a program called Pulse Point that we promote that people sign up and learn how to do CPR, and then their smartphone will actually notify them of a local citizen who may need CPR, which is a really cool program. And we're doing a lot of what we call safe sleep training, which shows new mothers or daycares and things, proper ways to put their infants to sleep, to give them a safe environment and prevent any kind of what we call SIDS or crib death you hear about, things like that. So we have just all sorts of different programs that we get involved in and really try to help be the coordinating body for all the different organizations in the county as well, to get them all working together and impacting the public health in general.
Yep. You mentioned the Pulse Point. Probably about a year ago, we had a medical emergency here at my office, and we thought the young lady was having a cardiac arrest, a heart attack, and all signs indicate, even the ambulance thought so. I mean, they took her out of here as fast as they could get her on the stretcher or gurney, whatever you call it. So, it kind of woke us up and made us think, at any given time we could have 40 people in our building. So, we made the investment in an AED and then posted it on the Pulse Point site so that if, and it's my understanding if somebody, a trained professional needed one of those, it was close by right here, they could come borrow ours for the community,
Yeah, that's really been an awesome program. You're exactly right. Like right now when I'm out, I mean, honestly, I'll admit I carry an AED in my truck, so I have one at all times. But
Yeah.
if anybody first responders out and needs one, they just hit a button on a map and it walks them right into the facility, and there's even a picture of it. Should be like yours probably has a picture on the wall of where it is, so somebody can easily find it. And one thing that's a little bit unique about our health department is overall kind of management of EMS falls under the health department in Clark County, and that's not the same everywhere. And so that's one thing we're really trying to do is, kind of improve the standard of care for our EMS systems. They do a great job now, but we really want to turn Clark County into kind of what we call a, early CPR resuscitation center where, we have just lay people everywhere that are trained in CPR, a nice AED registry of hundreds of AEDs, and really try to improve our pre-hospital care of our citizens. And I think that's really cool. We have a unique dynamic because, some of Clark County, Jeffersonville, is kind of an urban suburb of Louisville, basically. But then you get out to the far reaches of the county, and it's about, out where I am, it's about as rural as it gets. So we have kind of a broad mix. And I think by improving some of those pre-hospital things, we can really make a huge impact, which is awesome.
Well, thankfully, we've not had to use our AED, and now I think about it, it's been about a year since the lady came and trained us. I probably need to brush up on the training just to make sure. But for those of you not familiar with an AED, it's pretty foolproof. Once you have the training.
It essentially talks you through it. It tells you what to do. So even if you've never seen one and opened one up, it literally does talk to you and says, "All right, step one, do this." I mean, it's pretty self-explanatory. So, but again, it's always good that's what I tell everybody too, is, brush up on it. Pick one day a year that's your day to, change the batteries of your smoke detector, check your AED, do all those kind of routine maintenance on some of your public health things.
Yeah. When we first start talking about the AED, I was a little concerned, how are we going to know all this information and retain it? But then when it was as simple as it was, I was shocked, how easily you can impact and affect and save somebody's life.
And that's the thing is, if there's one thing that we do, we do all these different treatments pre-hospital and even in the hospital. But the two things that show to improve people's chances when they have cardiac arrest is early CPR and early defibrillation. So, those are things we're focusing on. We want, as many people as possible in the county to be CPR trained, and we want AEDs everywhere so that anytime something happens, you just have one, right down the block you can grab, and we hopefully will make a big impact that way.
Speaking of cardiac arrest, I'll give it a little shout out. When I put the post up about I was interviewing you today, my sister sent me a text and said, I'm so thankful for him because she had a heart episode about 8 years ago. I believe it was about 6 or 8. And she said, I'm here today because of Dr. Yazel. So she was so
Oh, wow.
thankful. Yeah.
Wow. Yeah. That's as cool as it gets.
Yeah.
That's what it's all about. So that's awesome. Thank you for telling me that. And thank her for telling you that to tell me, because
Yeah.
that makes my day. Because like I said, that's what it's all about. That's why we go in every day and do what we do. So that's awesome.
Right. So how about something interesting? You live on a farm in Clark County. So, something, what's Dr. Yazel like to do for fun when he's not saving lives?
I'm still a fish out of water on this farm. Like, I have no idea what I'm doing. So my father-in-law does all that. We used to have cattle and we actually sold them recently, but my father-in-law does all the work on that. I just kind of sit around the pool and watch all the activities. So I'm
Yeah.
always willing to work up a sweat, but as far as actually knowing what I'm doing, I'm still pretty clueless. So I can't claim too much on that. But I like to get out I'm a river rat. I have a boat down there at Admiral's Anchor in Jeff.
Oh, yeah.
I get out on the river a couple days a week, and I do a lot of kayaking and hiking and stuff like that out here. So, that's my thing is when, like I said, I do wear a lot of hats. I'm busy, but when I get away, I like to get away and have some, peace with nature and things like that. And then I have an 8 and 10-year-old. And I mean, if I could hit pause on an age range, it'd be right now. They're so much fun. Like, Dad's still kind of cool. So, and I know that's only for a few more years before they're going to be like, oh, here he is, so
Yeah.
I'm enjoying that a lot too. So.
Right. Well, it's been great chatting with you. Appreciate you joining in. Anything else you'd like the community to know about the health department or health in general? I will say, personally, one thing in the last couple of years, I've taken health and wellness a little more serious. But I think one thing that COVID has done, it has made our community a little more mindful of getting out and social distancing and doing making healthy lifestyle choices. So I would hope they'll continue to do that even when we open up and enjoying all the parks and different activities that we have around our communities that we're so blessed with. But anything else you would like to remind them?
Yeah, I just think, with COVID, it also opened our eyes to, some of our other community members that may be a little more vulnerable. And, I think that was one of the cool things about COVID is I think it did kind of increase our sense of community. And we had so many awesome selfless acts of people helping others and, supporting first responders and healthcare workers and things like that. And, that's what I want to encourage, just to maintain that sense of positive community. And you're exactly right. Everything kind of slowed down a little bit. We started spending a lot more time at home with our families and maybe getting a sense again of what's truly important. And again, I don't want to lose that. The quarantine was an extremely difficult time, but if we can take any positives of that, it's, to enjoy your time with your loved ones and, take your health seriously, and watch out for your community members that are more vulnerable. So, and I hope we continue that.
Okay. Well, again, Dr. Yazel, appreciate your time and thank you for everything that you're doing for Clark County. I've seen firsthand the difference that you're making through some of the events with Jeffersonville City Council. So we really do truly appreciate everything you do. You do seem to have a good pulse on what the community needs when it comes to their health.
Well, thank you for having me. Thank you for all you do in the council and everything else in the community too. So this is awesome, Matt. Thank you for having me today.
Okay. Thank you. Hey, we appreciate you joining live with Bill Burns today. Remember, like and share, and we'll give you a copy of Og Mandino's The Greatest Salesman in the World. Just got to mention you'd like a copy, but a little excerpt from scroll number 4, I Will Act Now. Og Mandino writes, "My dreams are worthless. My plans are dust. My goals are impossible. All are of no value unless they are followed by action. I will act now. Never has there been a map, however carefully executed, which carried its owner over even 1 inch of ground. When you think about it, all the plans are useless unless someone acts on them. It's great to plan, to discuss, and to practice, but until there is actual action on your part, they remain only plans. I will act now." Hey, again, we appreciate you joining. Join us Mondays at 10 a.m. on Facebook Live and YouTube for Live with Bill Burns. Thank you.